Hello, my name is Dr. Paul Simon. I'm a psychiatrist working in private practice for about 14 years now, ever since I graduated from the psychiatry residency program at WashU in 2009. This video is a little bit about an exciting new treatment called hallucinogenics, including psilocybin, LSD, and to some extent ketamine as well has some hallucinogenic properties. So I wanted to talk about these, but first please subscribe to my channel, and that really encourages me to make more interesting videos from a clinical perspective. I am not a researcher, I'm not a lecturer. I am in the trenches teaching people, individual people, helping them with their mental health problems. So every day I see people trying to help them with depression, anxiety, bipolar, schizophrenia, OCD, eating disorders, you name it, all that kind of stuff. So I'm not in some white tower. I am in the trenches trying to help people that come to me online and in person. Now, in the other videos, I've talked about antidepressants and mood stabilizers and antipsychotics and anti-anxiety medications, ECT, S-ketamine, and ketamine. This video, I wanted to talk to you a little bit about psilocybin and LSD. Now, psilocybin is a hallucinogenic mushroom. It's found actually in a number of different mushrooms. Is a chemical that basically releases a lot of neurotransmitters, primarily serotonin, all at once. The effect of this causes hallucinations and other reactions that can disassociate somebody from their cognitive, mental, and emotional state. So if somebody is really depressed and stuck in the mud, so to say, it can flood their system with all these different neurotransmitters and helps them almost reform new mental pathways or think about things in their life in different ways that they haven't considered before. An analogy that I think is apt for what psilocybin does is a flood. So, like I said, it floods all your brain with serotonin, and basically, if you imagine what happens in a flood, a river will overflow its banks, and a whole countryside is covered with water. All right. Now, if you've ever seen a flood, and I'm from Missouri, and I've seen a number of floods, the whole land just gets covered with muddy water, and there's fish everywhere, and it's just chaos, you know. And it's kind of like our brain when it's on psilocybin, it's just chaos. And there's fish perhaps and different things floating around, and it's quite an experience for anybody who's used that. Now, when the flood recedes, I'm talking about an actual flood, not necessarily in your brain, but the same thing. When the flood recedes, it can sometimes find new river channels, okay? The channel of the river that was before the flood may not be the same one after the flood. So sometimes that river finds a new pathway. Some of it may be the same, others may have different branches, and so the flood changes the river itself. In a similar way, when the flood of serotonin and the psilocybin effect wears off, our brain and pathways and the way the neurons communicate may find different ways to flow, essentially. Our consciousness can find almost a new river or a new conduit for its activity. So how that manifests itself can be a relief for a lot of people, or about thinking about things in a different way and looking at the world perhaps in a different light or than they had before. So typically psilocybin does not dramatically change directly the emotions, so it doesn't release a lot of dopamine. So dopamine is a brain chemical that is associated with rewards. So when we feel happy because we win the lottery, that'd be nice, that releases a lot of dopamine, or let's say we eat a candy bar, or have sex or something that's really pleasurable, it releases dopamine. Similarly, some drugs like methamphetamine or cocaine or even alcohol and marijuana will release dopamine, and that's what gets people addicted. It's that dopamine release. Now, psilocybin and other hallucinogens like that, such as LSD, do not release a bunch of dopamine, so they're supposedly not addictive. Now, that said, if somebody habitually uses them, I think there is a psychological addiction that can occur. So while it may not hit that dopamine, I think some people are at higher risk for abuse. Now, another word of caution with hallucinogenics is that sometimes they can trigger psychosis. Now, essentially, they do trigger psychosis while the effects of the chemical are going on. But the idea is to become not psychotic after they go away, and return to some normalcy. Now, the problem is if somebody is genetically susceptible to schizophrenia or psychosis, what happens if they take psilocybin or LSD? Well, it may trigger psychosis or schizophrenia. It might bring that out. So especially if they use marijuana, or especially marijuana or some other chemicals. So psilocybin and LSD are definitely not toys. They are not to be used recreationally, because there's a lot of other variables that can happen, So there's a lot of exciting research going on that have showed that psilocybin in one use can resolve depression in some people. Now, that's the studies that I've seen have not been large groups of people in the studies. These are small studies, but they're extremely promising. And the data is similar, from what I can tell, to that used for in ketamine and esketamine. The advantage, though, for the psilocybin is that it's, again, not addictive, at least not like ketamine can be. Ketamine can be very addictive. So anybody who has used or struggled with drugs and alcohol shouldn't be prescribed esketamine or ketamine, in my opinion. Whereas psilocybin potentially could be used in those individuals. Psilocybin's also been shown potentially very useful in PTSD. So people who are stuck with trauma and the burden of trauma can almost flood their system and be released from that to some degree. So it's a really exciting potential therapeutic modality. The question becomes, assuming that someday it does get FDA approved, which I think it's possible that it might someday, if the drug classification gets reduced from a class 1 down to a class 2 or 3, that means that the restrictions to its prescribing go away. Now, how would you manage somebody with psilocybin? Okay, it would be prescribed, but what do you do with it? Do you just give it to a person and they go home and trip, essentially? That would not probably be considered a safe treatment protocol, because people can have bad reactions to it, a bad trip, they say, where somebody is psychotic and has a panic attack or anxiety attack, and they're basically freaking out. So we don't want that to happen, obviously. So a controlled environment would be recommended, where somebody's safe and they can be kept safe, and interventions can be taken as far as giving them antipsychotics if necessary, or medications to reverse the effects of it can be given. So given that, like psilocybin, the effects can last 8 to 10 hours, where does the person go for those 8 to 10 hours? Do you let them drive home, or do they have to get a ride? Those 8 to 10 hours, that's a long time to be responsible for somebody going through a trip. Do you keep them in a room with a bunch of, psychedelic toys, or is there a therapist? What kind of environment is that? Is it a hospital setting, which I can't imagine would be very comfortable for somebody on psilocybin, or is it more of a natural kind of, um, retreat kind of situation that is, used a lot in native ceremonies, ayahuasca ceremonies in South America and things. So it's a much more natural, comfortable, um, free environment to a large degree. So, but as far as trying to incorporate psilocybin into modern medicine, there do need to be some standards of care and more formalized safety procedures, if nothing else for liability. Because if something happens, you know, it's a problem. So psilocybin, again, just to summarize, it's interesting. It floods the system, helps the brain and the mind perhaps find new channels, like a new river after a flood. The jury's still out how it's going to pan out. Now, is one last thing about microdosing. I hear a lot about microdosing. What that is basically taking small amounts of hallucinogens such as LSD or psilocybin to improve creativity or to maintain mood or improve cognitive flexibility. I'm rather skeptical about that, quite honestly. I think in theory it kind of makes sense from a pop psychology standpoint, but the problem is if you're constantly stimulating the over release of serotonin, it can reset its baseline in your brain. So once you stop, you'll be actually less creative than you were before, or less cognitively flexible than you were before. So you don't want to do that all the time, because basically your brain gets used to it, and it can be a problem. So not that you would have physical withdrawals from that, perhaps, but it would be more cognitive and creative dulling, perhaps. That's my 2 cents about microdosing. I'm not a big fan of it. So therapeutic potential is very interesting, but needs to be used wisely. So that's all I got for you on that topic. Hope it's been useful to you and interesting to you. And the research will be very interesting to follow over the rest of my career. So you all take care. Have a good one. Talk later.